All right, back home, the mental health of South African police officials is once again in the spotlight. The Independent Policing Union of South Africa, or IPUSA, says poor decisions by senior managers are to blame for the high rates of suicide. Police officers have also, of course, been involved in crimes. An officer recently killed his girlfriend, a nursing assistant. To discuss, we're joined by the General Secretary of the union, Mpho Kwinika. Thank you for being with us. Firstly, can you outline how high the suicide rate is and what the mental health issues among officers are at the moment?
Good afternoon, South Africans. Yes, we have got a very serious problem in policy. I think the situations that we have, which has got to do with command and control, it is having a terrible impact on men, women in blue. These issues we have been talking about for the past 30 years. And it is even worse today because the current management of the police are looking after their survival in policing as opposed to take care of the interests of South Africans and the interests of the policemen and women in blue. So these issues need to be taken care of seriously, or else South Africans are going to continue and have the problems of not being taken care of by the system itself.
How are they not taking care of their subordinates? What should police managers be doing that they are not doing?
Look, the police have a system that we call the Employee Health and Wellness Program. This program its responsibility is to make sure that police officials' mental health is taken care of. This department comprises of the psychological section, the social section, and even the chaplain services. These people knows exactly what is it that is required of them to look after the interests of the police men and women in blue. Let me just give you an example. Police officials on daily basis are confronted by serious issues which happens at work and serious issues which happens in their families. When they move from one environment like family to a working environment, they must find a system that is readily available to make sure that their state of mind is prepared to deal with issues of both at work and even at their families. Currently, police officials are working, they are left to fend for themselves. You will see what has happened now. I think yesterday, the last person to commit suicide so far, it is a captain in KZN. You will hear that it's something that has got to do with the management of policing. If you have what we call the MBO principles and the MBEs, the MBO principles says management by objectives. Anything that you do, you have to do it by the book, because the members who are trained to follow the book. If you change the book, it confuses the members. So we are saying as IPUSA that these people are not getting that support which is mentioned in the book. We need to go back to the basics.
So give me some tangible examples here. If you are a police officer, say you're involved in a traumatic event, at work, maybe you've been involved in crime fighting, or at home something terrible has happened. How easy is it to access that counselling? Because you say there are psychological services. So how are managers blocking staff from accessing those services, or are they just not enough?
It is the issue that has got to do with the ranking system of the police. You know, if you go and study the relationship between the police officials in Australia, Canada, you will see that they have outsourced this product. This product, police officers in that environment, they may access it in hospitals and other environments that are made available to them. In the police in South Africa, you have to confront the employee health and wellness program, so that they are in a position to understand exactly what has happened to your mind. Let me give you an example. the issue of the debriefing sessions. Immediately when you are involved in any traumatic environment, there are departments which are deployed to you and your family as well, and the colleagues who are part of you, to come and give you the debriefing sessions. We have got a very serious problem with that department, because currently, if you are wearing a rank and the officer that comes to you to come and give you counseling, and the issues that you are faced with are coming from the police themselves, and that police officer has got a rank that is even higher than the rank of the person that is coming to you, you are completely going to reject the services that are being given to you. So we, as the independent policing union, we are saying de-link, detach the issue of the rank to the profession itself, and allow the police officials to choose where to go when they are confronted with the mental health problems.
Yeah, well, it makes absolute sense what you're saying, that people may feel scared to give information. It could be used against them or be used to undermine them in their careers, or they just don't trust that something will happen if it's a problem within the police. So what can be done about your calls? Have you received any comeback?
We are continuing to engage management on this one. And I can tell you, South Africans, the police are here to provide safety and security to all inhabitants. They must do this without fear, favor, nor even prejudice. When they are busy doing this, we as unions have got a role to play. Our role is to ensure that the environment is conducive for them to can work in. We are engaging not only with the National Commissioner of Police, even the Minister of Police, to make sure that these resources are made available. It is not a favor. It is a must that this should take place, that these institutions should be made available, the services should be made available to these police officers. But here is another thing. The members of the Employee Health and Wellness Program, they are not being taken care of. No one takes their reports seriously. Members goes out there and say, here is the issue, I've got a family problem, I need to be transferred out of this environment. And you find that management refuses to allow these people to go there or even make a decision contrary to the decision that is made by these professions. These things need to change, and the commanders must stay away from this profession and allow these people to do their work.
All right, calling for more mental health care. Thank you very much for your time tonight. The General Secretary of the Independent Policing Union of South Africa.